Good morning, Andrew McDiarmid here from Clyde Vet Group. I hope you're all well and your families are all safe. It's obviously unprecedented times at the moment for us all, and we're, like everyone, very conscious of looking after the elderly, protecting the NHS and our staff. Clyde Vet Group is no different than anyone else with regards PPE and protecting ourselves, and we are trying our best to maintain social distancing at all times when dealing with our patients. This has obviously reduced considerably the number of services that we can offer to you. And we are trying to do as much as we can by telecommunications and by use of videos, pictures, etc. Going forward, we may start to do more routine work under safe, risk-assessed conditions, but at the moment our position is, as it's been since the start of lockdown, that we will remain practice who will only undertake emergency situations and situations where the welfare of horses is threatened. Following our request on Facebook, we decided to do a presentation on abscesses in the feet. Foot abscesses are one of the most common conditions that any equine vet comes across, and is something that owners are involved with the treatment and will come across. If you've owned a horse for many years and you've never had a horse with an abscess foot, you've been very lucky. So what do we mean by foot abscesses? Well, we're going to discuss in this talk, to use the medical name, intramural abscess, which is an abscess within the horn of the hoof capsule. And these are what the average foot abscess that many of you will have seen and had to deal with. And then we do get more complex abscesses, which basically means that the infection is below the level of the hoof capsule into the laminar tissue, the sensitive tissue, the bones, the ligaments, and the joints. So before discussing about abscesses, I'm just going to give a few slides to demonstrate about the hoof capsule, how it's made up, and following on from that, then you'll understand as to why an abscess behaves the way it does and why we treat them in the manner that we do. Obviously, the horse's hoof capsule is an adaptation of epithelial cells, of skin cells, and is in some way analogous to our nail. On the outside, we've got a relatively regular, straight dorsal hoof capsule. And then on the underside, as you may obviously know, there are different parts of the hoof. There's the solar area, which is the largest area, the frog towards the middle and the back, the bars of the foot here that are an infolding of the wall, very important for the strength of the horse's foot, and the outer hoof wall. Covering all dorsal hooves, we have the periopal, which is an area of thin, waxy material which protects the keratin of the wall. Human nails have a similar type seal on them. The hoof, as you may well know, the dorsal hoof capsule is produced from the coronary band, and the hoof grows from that area. There is no growth of the dorsal hoof from, in normal horses that is, from anywhere barring the coronary band. So here is a hoof capsule in its entirety. We can see the outer aspect here. This is where all the horn is produced, and as you'll see in a minute, there is little laminar leaves here, which, and you go down the bar, you can see them here, which are involved in the strength and the linking of the hoof capsule to the underlying soft tissues. If we take a closer look at the actual hoof as it reaches the solar surface, we'll see that there's the large outer stratum medium, or the bulk of the hoof, and it has two areas: the inner wall and the outer wall, and then the junction between the sole and the wall, which is down in here. You see just there, which is the so-called white line. Taking a closer look here in a higher detailed photo, we can see the laminar leaves and the wall. And a histological slide, a microscopy slide, we divide the hoof into various areas. The outer area, the stratum externum, which is quite a thin area, the stratum medium, the middle area, and the stratum intimum, which is involved in the laminae here. The stratum medium has these two zones that you can see, the more dense outer and the inner softer area, and this is the weak point here that we'll talk about later. So this is a specimen of a lower leg that's had the actual hoof capsule removed, and you can see the respective interdigitating leaves here, the laminae that will slot into the hoof capsule to provide a huge surface area for the attachment of the hoof to the wall. On the underside, we have similar attachments here on the sole, not in a laminar form, but more of a villus form. And then we have the frog here as well. To show this in a more real life, you can see how vascular, how great a blood supply we have of the laminae here, and how it interdigitates here down onto the sole. And we can see the coronary corium here, which produces the dorsal wall. Here is another specimen here, just to highlight this area in more detail. This is the coronary corium. This is the vital part of the hoof from which the hoof is produced, the dorsal hoof capsule is produced, and how it interdigitates down here with the laminae, which, as some of you may know, is the laminae is what is affected with a laminitis. So the laminae itself, the dermal laminae, is only a few millimeters thick, and it is attached to the underlying pedal bone, or distal phalanx, to use its medical terms. So here is the laminae in detail. You can see it's very rich blood supply. Pedal bone here. I hope you can all see that on your computers as I mark it out. And the villus interdigitation here on the sole with the sole horn. And here is how that all attaches together. So we've got the dorsal wall, the solar horn, the pedal bone, and the laminae between the areas here. So each of the three structures, the pedal bone, the laminae, and the horn itself, are all very closely bound together, and changes in the pedal bone will be reflected in the wall and vice versa. So if we then look at the sole here, this is where the horn, you can see a picture on the right here where the horn of the sole has been reflected back to show this very vascular solar corium, in some respects very similar to our nail bed here. This is the tissues that produce the horn that are reflected, obviously, what we see outside. And this is a section through that area highlighting again how the horn and the sole and the laminae are all interrelated. So having had your lesson on anatomy, let's talk about typical foot abscesses. So the main causes why a horse will get a foot abscess, in other words, a build-up infection focally in the horn, is either due to a penetration, such as this nail that unfortunately has just gone into the sulcus of the frog here, the introduction of dirt, but also certainly in Scotland in the wintertime and particularly in clay areas, is the introduction of bacteria via excessive moisture that's in the ground, in muddy fields, poorly mucked out stables, wet, damp stables, where obviously the moist environment results in bacteria and moisture being able to get deep in the hoof, and the bacteria then multiply to produce an abscess. But abscesses can also occur secondary to other issues. So one common secondary cause of an abscess is a crack. So a small crack in the hoof capsule here breaks that nice tight bond of the healthy tissues through which grit and dirt can get in, or as I said earlier, moisture get into that area up the wall and introduce bacteria. So typical sites for the introduction in cracks are up the white line, such as here, or we often see them on the bars, an abscess develop somewhere down the bar, often about halfway down here. Or there can be more substantial cracks, such as this case here, or poorly trimmed or broken up feet provide an area for the introduction of bacteria. Farriers can inadvertently introduce infection, but potentially by a nail bind. So where the nails are placed too far too far inside the white line, getting close to the sensitive structures, which results in sensitive structures either becoming inflamed or damaged and becoming a focus through which infection can get in. Here's a cross-sectional view of a horse that's got nail bind, so it's very close, if not touching the laminae here, pedal bone, laminae, dorsal wall here. So that's an example of where, inadvertently the farrier may have just put a bit too much pressure on the sensitive structure of the foot, which then becomes a nidus for introduction of infection. Or occasionally, but these days it's very rare, and actually the nail has actually pricked the sensitive structures, so you're creating a portal from the outside into the sensitive structures. That's very unusual, but it occasionally happens. This is a normal positioning of nails, but had the nail been mal-positioned, it may have gone straight into the sensitive structures. And another very common cause of that may be lead to the formation of an abscess is in horses who have laminitis, particularly chronic laminitis. And as a consequence of laminitis, the normal architecture of the hoof is lost. And here's an extreme case of laminitis here with a huge wedge of secondary laminae. The whole architecture of the foot is wrong, and the tightness of the normal stratum medium and the normal structure of the foot is lost, and this hypertrophy tissue becomes a void in which infection can develop. And here is a horse with chronic laminitis where one can see an abscess has burst out at the coronary band. You can see that this horse is obviously undergoing extensive treatment for laminitis as it is, but the abscess has developed either, as I said already, because of the void created by this secondary wedge of tissue, or also because as part of laminitis, the soft tissues and the bone become have reduced blood flow and become compromised, and as a result of that become less able to ward off infection, and they become a nidus for infection. The other thing occasionally happens is a horse sustains a bruise or trauma to the solar surface. Here is a bruise here, probably induced by a shoe, I'm not sure, but a bruise here. Here is a more typical extensive bruising on the sole of the foot. And as a consequence of these, again, tissues become compromised and more susceptible to infection. And as a vet, we often arrive at a horse on day one, and the horse is very lame, and it's unclear whether it is a bruise or an abscess, and it can, obviously, as I'm intimating here, be both, that the horse has had some trauma, has had some bruising to the sensitive structure of the foot, and as a consequence of that, then that subsequently becomes infected. The end result, however, is that we get the build-up of infection and generally the build-up of a pus, and we get a build-up of fluid-filled pus pocket. Now, the foot is no different than an abscess building up anywhere else in the body. The build-up of pressure causes the extreme pain that we associate with an abscess foot, and the release of the pressure in general will relieve a lot of the pain. But nature is not daft. The build-up of pressure realizes that the abscess has to discharge to the exterior, be rejected, as it were, from the body, and build up and burst out to through the plane of least resistance to an area that and I'm going to talk about the planes of least resistance on the course of which abscesses take. So we know that on the wall of the foot, just in this area here, in the soft area that I highlighted before, is the plane of least resistance. And this tends to be where abscesses will track up and dissipate the pus material. So there is where we normally associate, in that area there. It is not, as possible people think, at the junction of the sensitive and the insensitive laminae. In other words, the red, as we showed before, the red vascular dermal laminae and the dermal laminae. It is actually in the stratum medium here. So if we take a horse's foot, here the solar surface, and if we say we have an abscess inside the white line in this area here on the sole, the arrows are indicating where the abscess has started. Let's say it was a penetration or a wee void. So the abscess in these solar situations will tend to move in the plane of least resistance towards the seat of corn, this area here, where the arrow is, then track up and burst at the bulb of the heel here. So again, I reiterate, that's solar penetrations, and this is often the most common area they burst up. So what you realize is that they're moving away from the sole to the seat of corn and up the laminae against gravity, which is important to note, and bursting out at the seat of corn. Here's another one that's burst out here. Okay. So that is the most common progression of an abscess following a penetration or build-up of pus on the sole. If it is at the level of the white line, the build-up in that area there, so this is generally on the solar aspect, then the abscess plane of least resistance will be up that stratum medium and will burst out at the coronary band. Again, I reiterate that is against gravity, bursting out at the coronary band. We can sometimes have the luck of seeing these abscess here. So here's the abscess building up. It's got bacteria producing gas. So we can see that black on an X-ray, and it will track up and it will burst out there at the coronary band where the second yellow arrow is. Now, these are abscesses that have been paired out to show you that this has been a long-standing abscess, and it started in this area here, moved in the plane of least resistance to the seat of corn and burst out here. You can see it's long-standing because actually it's already started to produce nice healthy horn underneath it. Similar to if you happen to unfortunately get your nail stuck in a car door or something like that, you know that if you lose your nail, then the horn, the nail tissue, sorry, is very easily produced. It's the softer, yellower horn, nail tissue there, and that is healing well. But that's just to highlight the plane of least resistance. This is an abscess that's occurred under the frog, and you can see again how it's a cleave plane here, and we can see how the frog has lifted off and the abscess has moved to the exterior and burst out in this area. So you could argue, if nature does this so well and it moves in the plane of least resistance and it bursts out and the abscess is therefore is released, the pressure and the infection is released, what is the bother of, or what is the need to treat an abscess foot? Well, there are many reasons. First of all is that it can take several days, occasionally a couple of weeks, for the abscess to actually burst, relieve the pressure and settle down. And if we intervene, then we will be able to get this resolved quicker and the horse will be able to return to work. And as part of that, obviously, then there will be less tracks and planes of which the abscess takes to the hoof capsule. So the picture I showed earlier of the abscess that tracked under the sole right the way around the seat of corn, if that had been dealt with quicker, then that whole damage and that separation would not have occurred. Clearly, as a vet, we're interested in alleviating pain and suffering for the horse. And if an abscess is not treated, then you will get the subsequent abscessation a few weeks later, and then you'll get one abscess, a well-formed abscess, with a secondary abscess underneath. The other aspect is that there are secondary issues that may occur following an abscess. So in foals, if the horse is in a lot of pain for a while, the opposite limb to which the foal is bearing a lot of weight, will start to take more pressure and may start to develop a slight bend in the leg. And severe cases will induce laminitis. What are the signs that we would normally associate with a foot abscess? Those of you who've had horses with abscess feet may have had it confused that the horse may have a fracture. They are that lame. And the We are often asked to come see a horse because they think it may have broken its pedal bone or may have fractured its leg. And when we arrive, it's found to be an abscess, much to everybody's relief. The toxins and the inflammation in the lower leg, in the foot, sorry, will induce swelling of the lower limb. And often the swelling will give us a wee help as to where the abscess is. So what I mean by that is if the abscess is on the inside of the foot, the swelling up the lower limb will be more on the inside than the outside. So it's a little helper for us. There will be an increased pulse to the foot. That is a reflection of the blood pressure within the foot. And just as if you have an infection in your finger yourself, you'll know it's a bounding, pulsing inflammation. As vets, we will apply hoof testers, and obviously where the abscess is focally painful, and that is often the #1 test that we will use to diagnose a foot abscess, is the use of hoof testers. If an abscess is close to bursting out, then we'll get some swelling and pain at the area on the coronary band or the bulb of the heel where the abscess is about to burst. So that will help us. We'll be able to follow the line of the laminae down to the foot and find out where it is below that. Obviously, indicators as to where abscess may develop, they will get through hoof cracks, or we may find a nail. A nail is, when we use application of hoof testers, there's a nail that's particularly painful. All these things might tell us where the infection has got in. Horses with laminitis who develop subsequent abscesses are often a real challenge for vets, because the horse may already have a distorted foot. There may be quite a lot of pain non-specifically as a result of the laminitis, but yet within that there is an abscess. Occasionally, because of the toxin reliefs, and the horse may actually show sign of an increased temperature, be pyrexic. Not often, but that occasionally. So the main aim of the vet's treatment is to create drainage for the abscess so that we can alleviate pain, let the pus drain, let it drain gravitationally rather than bursting out at the coronary band against gravity or the bulb of the heel, and therefore that will release the pressure and pain. So we will be specifically using hoof knives on the areas of pain on application of hoof testers, and these will typically be just inside the white line, at the seat of corn, just where the abscess may think about bursting out at the above it at the white line and in the bulb of the heel, and in the bar region. So we're trying to create drainage using gravity rather than allowing it to burst above against gravity, and that way it will get resolved quicker with less separation of the hoof, and obviously doing less damage and getting you back on the horse quicker. So here is an abscess that has burst out at the toe here. You can see that thick black pussy material that's discharging. In that case, if a small hole can be opened to release the pressure, this will resolve very quickly. In 2 or 3 days, the horse will become sound again. If, however, that we're not called or that's left for a while, then as stated already, the pus will move in the plane of least resistance to that acetocorn before bursting out at the bulb of the heel. And the vet or farrier may have to remove the horn to gain access to the abscess. Here is an abscess that's been underneath the frog. You can see how it is burst out in the plane of least resistance. To allow this area to dry and to take the pressure off it, we may have to remove some of the overlying frog tissue. You can see this is a lovely, healthy, new young frog that is growing from where the frog laminae are. Here is another abscess that has burst. There's a probe here to highlight how it's burst. And it's burst out in this cleave plane. This is much younger area of horn here. And this case, the nidus has been down here, which actually has been in an area of infection in the pedal bone, which I'll discuss later. But that has been the source of it. The abscess pus material has moved in the plane of least resistance and burst out here. So as an owner, how can you get involved in the treatment for a simple abscess? If you are sure it is an abscess, then in some cases, a poultice will help bring the abscess to a head, to a point earlier than nature would. I'm going to discuss about poultices later. Generally, it's obviously better a horse is kept stabled with an abscess foot. You don't want the horse moving around too much on a already very painful foot. And in most cases, a vet will be required to deal with the case and release the pressure from the abscess. Some farriers may be involved in the treatment of abscesses, but in general, it is the veterinary surgeon. So what is a poultice? I'm sure you're all familiar with poultices. Most poultices work by the use of osmosis. You go back to chemistry. Osmosis is using a differential movement of water, and osmosis draws out the water and hopefully in doing so, the purulent material from the hoof. There are many commercial brands available. This is the most popular one that is used. It is speeding up the bringing an abscess to a head along the plane of least resistance. It initially softens the foot because it's drawing, it's moist, and it's softening the area. However, the next slide demonstrates other ways in which you can help bring an abscess to the head. Tubbing the foot in warm water will also soften it, and this is reverse osmosis. So this is softening by putting water into the hoof. That will also help. Here's an extreme example, very colourful horse that's having 3 feet tubbed in water. Interesting, the 4th foot has already got a bandage on it, possibly a poultice. We will often use nappies as well as a way of absorbing abscess material. They're cheap, practical, and fit exactly over a horse's feet. The larger sizes, the size 4 in particular, are good for most thoroughbred type size feet. And the poultice or nappy is is held in place with some bandage material, sometimes duct tape or electrical tape, which does encourage the foot to sweat a bit, which might help also draw things to a head. The downsides of a poultice are that after a while, particularly those that are drawing water out of the hoof, will after a few days make the hoof harder because you're taking the moisture out of it. You're also, the foot is covered, and so it gets harder. So this is an extreme example here of a Clydesdale foot that had been bandaged and poulticed for a long period of time. It was as rock hard, it was brick hard. And that can actually make the vet or the farrier's job much more difficult in paring away the excessive hoof. It makes the frog tissue often very soft, and the natural secretions from the frog, those of you who've used the poultice will see that you get the black discoloured secretions in the cleft of the frog. They can confuse owners that that is actually pus material when it's just the natural area. So it's made worse by the frog being made soft. And on occasions, poultice can be used as an excuse almost for the poor paring of the horse's foot. Ideally, we don't want to rely on a poultice at all. We want the paring of the foot to relieve the pressure, and therefore, once the pressure is off the area, there is no need to draw out. Nature will take care of it because we're using gravity as an exit point for the infection. So I hope that explains some aspects of abscess feet, why they develop, and why we treat them in the way we do. If you do happen to have a horse with an abscess foot, please give us a call. We'll be able to help you how you deal with it and instruct you on the different ways in which you will be involved in the treatment of the horse's foot. Now, occasionally we will have a situation where we have a complex abscess. Now, a complex abscess simply is where the infection has gone deeper than the hoof, the nail bed, if you analogy to humans, and it is into the more sensitive structures of the foot, so below or including the laminae. So the structures that could be involved in this are the distal phalanx, to use medical name, or pedal bone. A lot of horse owners would rather use that term. This is the pedal bone here in this section through the horse's foot. The digital cushion, the spongy area that is underneath all of the frog. If it is deeper than digital cushion, then we have what's called the deep digital flexor tendon that runs from the back of the knee right the way down to attach onto the pedal bone. Occasionally, it will have gone into the coffin joint here. You can see the coffin joint here has got dye in it, a little hole here, down here, between the navicular bone and the pedal bone. This is the coffin joint. And it might occasionally go through the foot right up into the wing gall here. And there is also the involvement of the navicular bursae here, this dye area here. When we have a complex abscess, we virtually always have a concurrent normal intramural horn abscess, as well as the deeper structures. So we may well, if a horse stands on a nail that goes sadly into the navicular bursae here, we will generally have also an abscess under the frog as well. So again, to go back to our anatomical slides, here is the laminae here. It has gone deeper than the hoof. It's gone into this area. And if you happen to have found penetration in that area, you will know generally that it has penetrated the deeper structure, because if you remove the nail or if you look at the foot, there will be blood at the time. And it's virtually, these complex abscesses virtually always occur following a penetration or a wound. Here are some examples. Here's a nail, sadly, into the middle third of the frog. Here's probably difficult to see, but a small nail here in the back of the frog area. Here's a radiograph of a rather substantial nail going into the foot. Here are some other radiographs here. This is a nail going to the digital cushion. This is one going onto the navicular bone and into the wingall, the digital sheath. And here is one that has gone through the deep flexor tendon between the navicular bone and the pedal bone into that little infolding of the coffin joint. And this will obviously have gone through the deep flexor tendon, the navicular bursae, and into the coffin joint. This is probably the worst scenario. So just taking a normal horse's foot, if we have a nail penetration on the solar area here, right up into the bars, and it's a complex abscess, so it's a deeper abscess, the worst scenario in general, and that is that it will have damaged the pedal bone. So the pedal bone here. So nail penetrations in this area, that's what the worst scenario, as it were, in general. If, however, the nail penetration occurs in the region of the frog and the sulci of the frog, in this area, if the penetration is perpendicular, 90 degrees to the sole, it will, as the red arrow indicates here, potentially have gone on to the deep flexor tendon. If the penetration is in the middle third and it's perpendicular again, 90 degrees to the foot, then the penetration could go through the digital cushion into the deep flexor tendon, and in some cases deeper into this structure here, the ink dye here, the navicular bursae. You can see the limits of it here highlighted. If it's between those areas, the middle third and the front third, occasionally penetration will go through the navicular bursae into this little gap here into the coffin joint, such as the one I demonstrated earlier. Complex abscesses, thankfully, are something an average horse owner will not have to deal with in their career, their horse owning career, thankfully. They are unfortunately far more serious than a normal abscess, and they generally become a surgical emergency rather than just a farriery issue. The prognosis depends on which of the structures have been damaged or involved, if we take it broadly, infections into the pedal bone, so these are the ones that involve the area of the sole, despite sometimes quite a considerable amount of damage, have a relatively good prognosis if managed correctly. When navicular bursae and coffin joint penetrations have a much poorer prognosis and in general will not get better without operation. Pedal bone infections involve the removal of any compromised pedal bone, which may be infected or it may just, due to the trauma, have lost its blood supply and be rejected by the body. But removal of that removes the nidus, and the pedal bone is actually a very, very good healer, and it will heal well. This surgery may be done either standing or under general anaesthetic. Depends, probably number one factor, on the temperament of the horse. Will it be happy to do this? It is obviously done under local anaesthetic if it's done standing, or general anaesthetic otherwise. Whether it's a back leg or a front leg, obviously it's a bearing on whether the vet can hold the limb up or have the limb held up and the extent of the damage. These days, certainly at Clyde Vet Group, we do the vast majority standing. The defect where the piece of infected bone has been removed, as I said earlier, it does heal very well with a form of modified scar tissue, and the hoof will ultimately grow over the defect, and in many cases, in the years to come, you will not realise that there has been a loss of some of the pedal bone. The horse has the ability, it's quoted, to lose up to 25% of its pedal bone without it affecting its long-term prognosis. Infection deeper than this area into the navicular bursac and or the coffin joint, unfortunately, has a much poorer prognosis. And these are the generally nail penetrations in that middle third region of the frog. They must be treated aggressively to give the horse a chance to remain sound. The success these days, thankfully, is so much better with keyhole surgery, because we can get into the affected joint and flush out all the debris, the damaged tissue, the infection, the bacteria, and allow a normal environment for antibiotics to treat and for drainage. Unfortunately, however, despite our advancements in this, some horses do not recover. One key element to penetrations in the frog region, if at all possible, is that the horse is x-rayed with the nail in situ before it is removed. The reason for that is that we can get the exact orientation, extent to where the nail is going before it's removed, because the spongy nature of the frog is such that once the nail's out, you've got really it's very difficult to follow the track to find out where it has gone. And with digital technology, with DR technology, where the picture is essentially instantaneously, the vet can come out, take a radiograph with the nail in situ, and remove it on the one visit, and be able to give you a reasonably good prognosis, indication of the prognosis, treatment options there and then, rather than nail being pulled out and it's a wish and hope scenario. You can be told exactly, right, this is not too serious, the nail hasn't actually damaged any deeper tissues, or no, this is an emergency, we need to take it to hospital now because it has damaged the deeper tissues. Hopefully, as a horse owner, you will never have a horse that stands on nail its frog, but it's better to be forearmed. That brings to the end of this discussion on abscess feet. If following this you have any questions at all, or you just want to ring to ask me some advice on how you treat abscess foot, or if you disagree with anything I've said or want further advice, please give us a ring at the hospital. The phones are manned as normal, and we'll be happy to oblige. Most importantly, I'd like to say from all members of Clyde Vet Group, please stay safe, look after yourself and your families, and hopefully we will get through this coronavirus in a better state than. Take care. Thank you.